Good morning and welcome. I am Dr. Peter Holmes, orthopedic surgeon and host of your program, Ask the Doctor. My guest this morning is Dr. Richard Newman. Dr. Newman is a head and neck cancer surgeon. If you have any questions for Dr. Newman or any other of my guests in the future, there's two ways to reach us. Get us through the foundation at www.needfoundation.org or fax 696-9012. Well, political year. All these speeches out there, we're going to fix the system. I contend those that want to fix the system are the ones that broke the system. I want to talk about Medicare and its funding and what's happened over the years. I'm going to put it rather simple because I'm rather simple at this. Medicare was brought in the early 60s. Came through, great idea, take care of folks, break their hip, let's have Medicare. At that point, there was a Medicare tax. At that point, there was 8 people paying for every one recipient on Medicare. Now, the Medicare tax that was paid was more than was necessary for the number of recipients. 80%, that is 80 cents out of every dollar that was paid into the Medicare tax at that point was in excess of the monies needed for Medicare. Now, that 80 cents is sitting there. What did they do with it? They spent it. That 80 cents was not saved. Not one dime of it was saved at that point. So the 80 cents was saved. Now, Medicare is a trust fund. So the trust fund is owed that 80 cents by law. So what they have are basically special issue bonds or IOUs that the trust fund is now owed. They just can't spend it and say it's not there. The trust fund is owed that money that was spent. So everybody says, well, gee, that's great. Bonds are really safe. I want to invest in bonds. Well, what are bonds? If you have an envelope that says bond and you pop it open and look in there, there's no money. Everybody thinks there's money in there and it's tucked away somewhere and you're going to open it and there's the money. What's in there is the IOU slip, that is money owed. And that money that's owed when it comes due is paid for by taxing the population of workers at that time. So the entire IOU or trust fund is invested in taxation of future generations. So how much trouble are we in? Well, originally there was 8 workers for every one recipient. Now there's 4. We're paying about 15% into Social Security and Medicare, counting what you pay and your employer. In the year 2020, there'll be 2. So if we're paying 15% now with 4 workers for every one recipient, how much are they going to be paying in the year 2020 for Social Security and Medicare taxes? Well, I can double 15 and come up with 30. The answer is 30%. The average worker will have to pay 30% just to keep up with the standard that we have at this point. Except I forgot one thing. At that point, all the bonds are coming due that have been borrowed against. So the workers at that point, if it's coming through income tax, are not only paying 30% for Social Security and Medicare, counting their employer matching, they're also going to be paying more to pay back the bonds that are paying for the Medicare trust fund. The problem is we no longer have an excess in Medicare. As of 2005, Medicare is now receiving less than what's paying out, and so they're actually using the trust fund monies, which is taxation, to pay for this. Folks, you let this happen. It's not like this was a gift. You paid into the system for 45 years and it was spent. Social Security still has a surplus, and they're doing the same thing with that surplus. My idea, take it away from them. Take that Social Security surplus, invest it, transfer it over, start paying for Medicare, let it grow with the aging population. They're going to increase Social Security taxes, and they're going to spend the excess unless you don't let that happen. These are my opinions. Any comments? 2 ways to reach me. Get me through the foundation at www.needfoundation.org or fax 696-9012.
Clear vision begins with healthy eyes, and Medical Center Ophthalmology Associates is the largest group of eye specialists in San Antonio. They offer complete eye health services for the whole family. So, no matter how young you are or how young you feel, they've got you covered. From glasses and contacts or LASIK to macular degeneration and emergencies, they want to be your eye care specialists for life. Medical Center Ophthalmology Associates, specializing in your eyes, focusing on your needs.
Hi, I'm Danielle. I injured my knee back in February, but thanks to the foundation, I'll be playing again.
I'm Dr. Peter Holmes. The Orthopedic Need Foundation was formed to help those families who are underinsured or uninsured to return their athlete to their sport. Please help us to return kids back to their sport after injuries like this.
You can send your donations online at www.needfoundations.org or call 210-542-1722. All donations are tax deductible. Make a difference in a child's life.